Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights this hour. World Health Organization partners Yobe State government on safety advocacy to the hinterlands to flatten the coronavirus curve. And Australia's virus-hit state of Victoria reports its worst death toll and case rise. Welcome to the program. Nigeria is still far from its peak as the country recorded 404 new confirmed cases and 5 deaths last night. Till date, 42,208 cases have been confirmed and 19,004 have been discharged, while a total of 873 deaths have been recorded in the 36 states and the Federal Capital Territory. The new cases are reported from 19 states and the Federal Capital Territory. Lagos recorded 106, the FCT 54 cases, 48 was recorded in Rivers, 40 in Plateau, 29 in Edo State, 21 in Enugu, 20 in Oyo, 18 in Kano, 15 in Ondo, Ogun recorded 10, 9 in Ebonyi, 8 in Ekiti State, Kaduna 6, Cross River 5, Kwara 4, Anambra and Delta 3 each, while 2 cases each in Imo, Nasarawa and Borno states. The World Health Organization, in collaboration with Yobe State government, is asking survivors of coronavirus in the state to support the campaign against the spread of the disease so as to reduce community transmission. With representatives of the state government and the health body, they made the call in Damaturu while celebrating the patients who recovered from COVID-19.
We are here to celebrate with the state government because they have recorded remarkable achievements and milestones in the COVID-19 control efforts. Although we recognize that we still have some way to do, and we are continuing in the COVID-19 control effort, we are not relenting in that aspect. But this is a moment where we need to reflect on our gains and milestones and celebrate the successes that have been achieved, and then re-energize for the task ahead.
COVID-19 is one of the diseases that characterized with stigma. People don't want to associate with a victim or someone who has suffered from COVID-19. So for people to come out to give testimony, I think it deserves to be celebrated.
Now, due to the challenge brought about by the coronavirus pandemic, the Delta State government has announced tax relief to certain categories in the informal sector of the state's economy. Some of the businesses include private schools, hotels, private hospitals, among others. The Commissioner for Information, Mr. Charles Aniago, while briefing journalists at the Government House, Asaba, also ruled out some efforts by the state government in cushioning the effects of COVID-19.
We have been able to put in place some tax incentives. The reason is this. We believe that since most of the products or services rendered by this class of persons that we are going to afford to you affects largely the downtrodden, the people that are worst hit by the COVID. We are talking about those persons who run like maternity homes, some who provide services in the area of private schools that most of our children attend, so that we don't end up making it possible for our people not to be able to go to school. We're also talking about some persons who also provide certain services like hotels, those who are into the business of producing water, because everybody needs water, that if you don't give them certain incentives, they may end up passing that challenge to the people, which will mean that the people will now still have to suffer more than the COVID has placed on them. We're also talking about those who provide labor for some productive services. The reason for all this is to ensure that as a state government, we are able to still meet them halfway, and then through these processes, they are able to cope with the challenges of COVID-19, and at the end of the day, we are all able to pull through, beyond flattening the curve.
Now, as different states step up preparations ahead of the resumption of final year secondary school students next week, arrangements in Ekiti State are being fine-tuned along that line. Some parents spoke about the safe reopening of schools. Here's more with our correspondent, Babajide Agbayo.
Parents in Ekiti State are aligning with the resumption of secondary schools scheduled for next week for students in their final year. These parents believe staying at home indefinitely for students may not be the best option as countries across the world learn to live with COVID-19. They, however, want the state government to live up to its words in setting rules and making sure they work.
I believe they should resume. I think what is most important thing. The most important thing is they should put the necessary protocols in those schools.
And also they will also put some officials in different schools that want to resume so that they will monitor and be checkmating.
It's the final classes that are open, not the whole school. And because of the smaller number, they will distribute these children throughout the school. So for example, let's say the final class in the school is 50, and they have like 10 or 20 classes or blocks. So they put 10 here, go to the, they are trying very hard. So it's just to prepare them for their final examination. So it's not the whole school.
The days ahead will definitely spell out how these plans, promises and projections pan out. Babajide Agbayo for COVID-19 update.
Over in Lagos State, the government has received 10,000 spelling bee dictionaries for students as schools remain closed during this period. The donation, which was made through a non-governmental organization, is to help improve vocabulary and diction of students in Lagos. The governor says this initiative will ensure better education for the children and also prepare them for the future.
This is just their own demonstration of their love for the children and for educational intervention. We'll try and see how we domesticate this initiative. We'll try and see how we not just take the little girl from Vetland today, but go around all of our schools, and learning, especially English learning, becomes a strong tool that can define even what they become in future. I had seen the book privately, and I was amazed that there are some spellings there that I'm challenged. In confession, I'm challenged. And to see those words were words that were asked some primary or secondary school at some point in time, I needed to doff my tail.
For more on the efforts in flattening the curve, Professor Obinna Onwujekwe is a member, Ministerial Expert Advisory Committee COVID-19, several other committees as well, research, and this is all for solutions to the pandemic. He joins us via Skype from Nsukka. Thank you for joining us on the program. I'd like to begin by asking that when you look at the curve of COVID-19 in the country, are we headed in the right direction to flattening that curve? And this is with the interventions that we've put in place so far.
Well, thank you. We are not yet heading in the right direction. The curve is still going up, despite what we've done. So what we've done is not flattening the curve. So it's still going up, and so that's the situation right now. So we need to do more, both by citizens and by the government and its partners. That the curve is not showing any sign of flattening right now.
So is it a matter of things that we're not getting right, or we don't have the right data and science that is, of course, guiding our interventions?
Yes, maybe we were not very ready, prepared for the pandemic, at the time it started. And then, the political nature of Nigeria, where states are doing their things, the federal government is doing their thing. So that has also brought some problems, to the fight against COVID. But I think we are beginning to see things, interventions step up. But we've not gotten to that level where we think we can say, well, we are doing quite well and everything will flatten. For instance, we expected that the opportunity of COVID, that the health system will be strengthening, especially water and sanitation at primary healthcare level. But it's not happening. So things that we need to put in place for systems building, both in schools, primary schools, secondary schools, and in our health institutions are not happening. So, and then the citizens also, there's a lot of doubt again. So people are not doing what they should do. Lack of social distancing. So we are not there, until that awareness comes on both the citizen side and the government, really does start doing more. Then I think we are still a long way to go before we start seeing the flying of the curve in Nigeria.
So, as a member of the Ministerial Expert Advisory Committee on COVID-19, how much have, what's been the biggest challenge in terms of the duties of the committee?
Well, first of all, the committee is advisory. So we look at evidence around, we look at what is happening, we look at what the ministry wants, and then we advise on what should be done. But I think one of the biggest challenges we are not doing enough testing in Nigeria. So the testing is very low. Some states they've not even tested up to 1,000 people. So, and if you don't detect, we cannot isolate and treat. So I think the issue of testing is very, very is critical. And then the lack of personal or personal PPE, personal protection equipment, in our hospitals, in our primary healthcare centers. I mean, when you go to primary healthcare centers, where people that interact with people, you'll be shocked. In most of them, they don't even have any PPE. They've not even heard about PPE. So I think we need to get, see this fight against COVID as a systems thing, build a system, But I think the current approach of an ad hoc thing is part of the problem we're having. So things are not being done systematically in a way that build up a system to be able to respond adequately to the pandemic.
I also expect that those are also part of the recommendations you're giving, but in terms of the body language of those receiving it and then putting it into some of the interventions, do you think that they're listening?
Well, I think they're listening. They're listening, and then we sincerely hope that the advice we're giving advice on so many areas, not just testing, including treatment, including on research, including on vaccines. We hope those advice will be implemented, at least if not all of them, most of them, and that will really help the country to flatten the curve and to win this war against COVID-19.
Finally, are there certain areas you feel we need to engage more people and especially the community, seeing as we are experiencing community transmission in terms of more education, awareness to flattening the pandemic?
That is very, very important. I mean, many Nigerians still do not believe there's COVID. They're still living life as usual. If you go to the market, you'll be shocked. People are not washing hands. People are not maintaining physical distancing. So we need to do a lot more in finding more relevant way of communicating to the people so that they know that COVID is real and then it destroys. Until that, so that awareness needs to be built up. It's not yet there. We need to people are still not convinced. Even at government level, I'm sure you know the story. So a lot needs to be done. We need to engage a lot of civil society organizations, engage the religious groups, just as was done in the case of polio, to get people to understand and accept that the COVID is real. But I think it needs to build a broad-based coalition at the grassroots level. That is what we're doing. It's not what will happen with text messages, but it's what will happen with actual interaction by community-based organizations, religious bodies, people that the people they trust, because there's also a question of trust. Who do they trust? If people do not trust government, they will not listen to government. But if they trust religious leaders and their community groups and leaders, they will listen to them. So let's get to people that the people trust and use them to send information and convince them that COVID is real. Until they don't have to wait until then. Thank you very much.
Thank you so much, Professor Obinna Onwujekwe, a member, Ministerial Expert Advisory Committee on COVID-19. Thank you for joining us.
Thanks. Thanks for having me.
Ahead of school resumption in Enugu State, the government has handed over 13 completed and fully equipped school blocks, 66 classrooms and 23 conveniences to All Saints Primary School, formerly known as Ikulu Primary School, ahead of resumption, according to the chairman of the Enugu State Universal Basic Education Board. The gesture is being replicated across schools in the state for effective learning and the safety of pupils and students. And the debate continues, and this is over the efficacy of hydroxychloroquine as a cure for COVID-19. The World Health Organization initially recommended the drug, but later withdrew the recommendation following some scientific studies pointing out some fatal side effects. Dr. Sam Adikola is the National Chairman, Association of Community Pharmacists of Nigeria. He joins us here in Lagos. Thank you for joining us on the program.
Thank you. You're welcome.
All right, so what do you make of the controversy surrounding the use of hydroxychloroquine as a treatment for COVID-19?
Yeah, thank you. Hydroxychloroquine, for all we know, it's no drug, which has been with us. That's, of course, it's a derivative of chloroquine, which is an anti-malaria, which has been a mainstream treatment of malaria before now with us in Africa. Of course, over time, there was a failure with chloroquine, which brought in the idea of ACT, combined therapy, and chloroquine was prescribed, and which eventually it was stayed there. There are still persons who feel that, without chloroquine, they can't do well. And over time, the derivative hydroxychloroquine also become very useful in lupus, in rheumatoid arthritis, and all that. And however, when all of this things started, there were discussion around it, of course, in trials. And there are local trials, there are trials in different places, to the effect that hydroxychloroquine has been shown to have some benefit, particularly either has prophylactic uses or in an intervention which has to do with, maybe somebody who is not showing a symptomatic patient or somebody who is slightly showing symptoms. So there has not been serious debunk of this, sincerely yours, because persons have also, institutions, there has been testimonies in some different quarters to say that, yes, if these drugs is used at the beginning of this infection, it stands a great chance. So, and I think that is where outrightly the WHO has not debunked that, and which is the reason up to today there are researches that are still going on hydroxychloroquine at the even local level. I know here in Lagos, at Lagos Teaching Hospital, there's a research going on currently. In the world over, there are researches going on hydroxychloroquine. So it's a drug that has become maybe a little bit contentious, but sincerely, there are also claims and testimonies to show that it has shown some level of support, some level of, victory in this fight.
So, in your thoughts, we are fighting COVID-19. There's also been the challenge of misinformation. And some people have put the use of hydroxychloroquine as a drug that doesn't work for COVID-19 patients. Now you're saying that perhaps it works for those if they're giving early. Yeah. But then isn't this sort of freedom causing confusion in the fight?
Yes, that's the truth. But the point is that don't also forget that one major challenge we have actually had in this COVID pandemic fight is the fact that there has not been too much of serious working together. There has not been. We have not hacked together, even internationally, locally, even nationally in Nigeria here. So this is an issue. So if there's a claim and you feel that, yes, I have a claim about this, there's nothing stopped all of us from come together and come to a point. You understand? That's why we'll be able to inform people objectively and correctly. But when you leave people to, individual efforts, people acting in silos, to say, this is my effort, this is what I've done. So it's curate for a situation that we find ourselves on our table. So, and that's the serious issue. The great challenge is that we have not acted together world over. You see, WHO fighting, US fighting, these others, persons fighting, which is the same thing when you come back home here. Yes, there are efforts, but I tell you, as I speak today, we are far, far away from acting together on how to combat the pandemic. And that's the reason why, don't also forget the fact that there are quite a number, and that's another issue entirely on its own, that there are persons, even with or without drugs, will overcome the infection if they have their system fortified. Depending on the immunity level. So if the same set of person now use hydroxychloroquine, perhaps this is not working. If the same person use hydroxychloroquine and they come out of it, the only drug they will be talking about is hydroxychloroquine. And that's an issue.
So it's not a one-size-fits-all.
So,
we'd like to thank you. Thank you so much, Dr. Sam Adekola. Thank you for joining us on the program.
It's a pleasure. Thank you.
Australia has reported its highest number of confirmed cases in a day since the virus pandemic began. The state of Victoria is the worst hit, with outbreaks centred around care homes and workplaces in Melbourne and its sprawling towns. The state confirmed 13 new deaths, 723 new cases on Thursday. That's a 36% jump on the case record. Here's more now. COVID-19 global update.
The Australian state of Victoria has reported its worst ever daily increase in deaths and infections, prompting fears that a 6-week lockdown of the state capital, Melbourne, is not working.
We've now been in this lockdown now for some weeks, and we are not getting the results we would hope for. And as a result, the further measures that are taken are certainly necessary. They will come at an impact to the economy, and we understand that. But equally, not containing these outbreaks will have that effect also.
A partial ban on private gatherings, including weddings and funerals, is coming into force in some areas today, while everyone in Victoria will have to wear a face mask in public from midnight on Sunday. India has also set a new record for infections in a 24-hour period, with more than 52,000 people testing positive. India has the third highest tally of infections in the world after the United States and Brazil, while about 35,000 people have died. And over in the United States, Florida is to close its coronavirus testing centers as Tropical Storm Isaias approaches. The decision comes a day after the U.S. state reported a record 216 deaths. Meanwhile, the coronavirus has killed more than 150,000 people in the country. On the African continent, the Gambia's president, Adama Barrow, has gone into self-isolation for 2 weeks after his vice president tested positive for the coronavirus. And finally, the time people with coronavirus symptoms will have to self-isolate in the UK has risen from 7 to 10 days. The change comes as the government tries to avoid a resurgence of the virus. People are most infectious before symptoms begin displaying and during the first few days of the illness. But scientists say there is a possibility some people may still transmit the virus for up to 9 days after they become unwell.
For more information, take a look at our website, channelstv.com. It has the latest update on the pandemic. All you need to do is log on to our website. The latest story there, you can see the failure to wear face masks will attract 6 months imprisonment. Some state governors going tough on the safety protocols. That's the program this afternoon. Thank you for watching. I'm Millicent Wonwoka. Stay safe.